Good afternoon, everybody. I think all are know very well about this UDID. So UDID means the unique disability identity. So just like a Aadhaar card. Okay. So in that Aadhaar card, our disabled information is available in that card. Okay. So for example, ಜಸ್ಟ್ ನಾನು ಒಂದಷ್ಟು ಇನ್ಫಾರ್ಮೇಶನ್ ಅನ್ನು ನಾನು ಇದು ಮಾಡ್ಕೊಂಡಿದ್ದೀನಿ ಕನ್ನಡದಲ್ಲಿ. UDID ಕಾರ್ಡ್ ವಿಕಲಚೇತನ ವ್ಯಕ್ತಿಗಳ ಒಂದು ಏಕೈಕ ದಾಖಲೆ ಆಗಿರುತ್ತದೆ, ಜಸ್ಟ್ ಲೈಕ್ ಎ ಆಧಾರ್ ಕಾರ್ಡ್. ಓಕೆ, ನೆಕ್ಸ್ಟ್ UDID ಕಾರ್ಡ್ ಅದು ಭಾರತಾದ್ಯಂತ ಸಿಂಗಲ್ ಕಾರ್ಡ್ ಆಗಿರ್ತದೆ, ಜಸ್ಟ್ ಲೈಕ್ ಎ ಆಧಾರ್ ಕಾರ್ಡ್. ಸೊ ಇದು ಇಟ್ಸ್ ನಾಟ್ ವೇರಿ ಫ್ರಮ್ ಒನ್ ಸ್ಟೇಟ್ ಟು ಅನದರ್ ಸ್ಟೇಟ್. ಓಕೆ, ದಟ್ ಈಸ್ ಯೂನಿಕ್ ಕಾರ್ಡ್. ಸೊ ಇನ್ ಅವರ್ ಇಂಡಿಯಾ, so we can see unique ID in all over India. Okay, so that is similar card. Next, point number 3. So what are the benefits from the this unique disability identity card ಅಂತಂದ್ರೆ, if for example ನಮಗೆ ಸ್ಟೂಡೆಂಟ್ಸ್ ಗೆ ಒಂದು ಸ್ಕಾಲರ್ಶಿಪ್ ಏನಾದರೂ ಬೇಕಾಗಿದ್ರೆ we can use this kind of card. Then ಕೌಶಲ್ಯ ತರಬೇತಿ, ಸ್ಕಿಲ್ ಡೆವಲಪ್ಮೆಂಟ್ ಟ್ರೈನಿಂಗ್ ಅಥವಾ ಪ್ರೋಗ್ರಾಮ್ ಏನಾದರೂ ಬೇಕಾಗಿದ್ರೆ we can utilize this kind of card. Then ಪುನರ್ವಸತಿ ಯೋಜನೆ, ರಿಹ್ಯಾಬಿಲಿಟೇಷನ್ ಪ್ರೋಗ್ರಾಮ್ ಸಂಬಂಧಪಟ್ಟಂತೆ ನಮ್ಗೆ ಏನಾದರೂ ಬೇಕಾಗಿದ್ರೆ ಯೂಸ್ ಆಗ್ತದೆ. ದೆನ್ ಪಿಂಚಣಿ, ಪೆನ್ಷನ್ ರಿಲೇಟೆಡ್ ಗೆ ನಮ್ಗೆ ಏನಾದರೂ ಬೇಕಾಗಿದ್ರೆ ವಿ ಕ್ಯಾನ್ ಯೂಸ್ ದಿಸ್ ಕೈಂಡ್ ಆಫ್ ಕಾರ್ಡ್. ದೆನ್ ರೈಲ್ವೆ ಅಥವಾ ಬಸ್ ರಿಯಾಯಿತಿ ಏನಾದರೂ ನಾವು ಸರ್ಕಾರದಿಂದ ಫೆಸಿಲಿಟೀಸ್ ಏನಾದರೂ ತಗೊಳ್ಬೇಕಾದ್ರೆ ವಿ ಕ್ಯಾನ್ ಯೂಸ್ ದಿಸ್ ಕೈಂಡ್ ಆಫ್ ಇದು ಏನು ಯೂನಿಕ್ ಡಿಸಬಿಲಿಟಿ ಕಾರ್ಡ್ ಅನ್ನ ಯೂಸ್ ಮಾಡಿದ್ರೆ ಬಹಳ ನಮಗೆ ಅನುಕೂಲ ಆಗ್ತದೆ. ಸೊ UDID ಕಾರ್ಡ್ ಅಲ್ಲಿ ಏನಿರುತ್ತೆ ಅನ್ನೋದು ಬಹಳ ಪ್ರಮುಖವಾಗಿರ್ತಕ್ಕಂಥ ಅಂಶ. ಸೊ ಅಲ್ಲಿ ಒಂದು ನಮಗೆ ಒಂದು 5-6 ಒಂದು ಡೀಟೇಲ್ಸ್ ಅಥವಾ ಇನ್ಫಾರ್ಮೇಶನ್ ನಮಗೆ UDID ಕಾರ್ಡ್ ಅಲ್ಲಿ ಸಿಗುತ್ತೆ. ಪ್ರಮುಖವಾಗಿ ಏನಿರುತ್ತೆ ಅಂದ್ರೆ ಅಪ್ಲಿಕೆಂಟ್ ನೇಮ್ ಇರುತ್ತೆ ಸೊ UDID ಕಾರ್ಡ್ ಅಲ್ಲಿ. ದೆನ್ ಇಮೇಲ್ ID ಫೆಸಿಲಿಟಿ ಅದರಲ್ಲಿ ಇರ್ತದೆ. ದೆನ್ ಮೊಬೈಲ್ ನಂಬರ್ ಇರುತ್ತೆ. ದೆನ್ ಡೇಟ್ ಆಫ್ ಬರ್ತ್ ಇರ್ತದೆ. ಹಾಗೆ ಏಜ್, ಸೊ ವಿ ಕ್ಯಾನ್ ಸಿ ದಟ್ ಏಜ್ ಡೀಟೇಲ್ಸ್ ಆಲ್ಸೋ ಇರ್ತದೆ. ಆಮೇಲೆ ಜೆಂಡರ್ ಇರ್ತದೆ. ಓಕೆ, ಸೊ ವೆದರ್ ಇಟ್ ಈಸ್ ಮೇಲ್ ಆರ್ ಫಿಮೇಲ್, ಆ ರೀತಿ ಇನ್ಫಾರ್ಮೇಶನ್ ಇರ್ತದೆ. ದೆನ್ ದಿ ಮೋಸ್ಟ್ ಇಂಪಾರ್ಟೆಂಟ್ ಈಸ್ ಡಿಸಬಿಲಿಟಿ ಪರ್ಸೆಂಟೇಜ್. ಸೊ ಅಬೌವ್ 40 ಏನಿರ್ತದೆ, 40, 50, 60, 75 and 75 and above. ಸೊ ಈ ರೀತಿ ಆಗಿರ್ತಕ್ಕಂಥ ಒಂದು ಇನ್ಫಾರ್ಮೇಶನ್ ವಿ ಕ್ಯಾನ್ ಸಿ ಇನ್ ದಟ್ ಕಾರ್ಡ್. ಅಂಡ್ ಸ್ಪೆಸಿಫೈ ದಿ ಡಿಸಬಿಲಿಟಿ ಟೈಪ್ ಆಫ್ ದಿ ಡಿಸಬಿಲಿಟಿ ಏನಿದೆ. ಸೊ ಆಲ್ರೆಡಿ ಈಗ 2016 ನಮ್ಮ ಡಿಸಬಿಲಿಟಿ ಆಕ್ಟ್ ಪ್ರಕಾರ ಸೊ 21 ಡಿಸಬಿಲಿಟೀಸ್ ಇದೆ. ಅದರಲ್ಲಿ ಯಾವ ಕ್ಯಾಟಗರಿಗೆ ಆ ಒಬ್ಬ ಡಿಸಬಿಲಿಟಿ ಬರ್ತಾನೆ ಅಂತಕ್ಕಂಥ ಒಂದು ಡೀಟೇಲ್ಸ್ ಅದರಲ್ಲಿ ನಮಗೆ ಇನ್ಫಾರ್ಮೇಶನ್ ಸಿಗುತ್ತೆ. ಆಮೇಲೆ ಡಿಸಬಿಲಿಟಿ ಸಿನ್ಸ್, ಸೊ ಅದು ಯಾವಾಗ್ಲಿಂದ ಇದೆ, ಯಾವ ರೀತಿ ಇದೆ ಅಂತಕ್ಕಂಥ ಒಂದು ಇನ್ಫಾರ್ಮೇಶನ್ ನಮಗೆ ಸಿಗುತ್ತೆ. ಅಲ್ಲಿ ನಾವು ಒಂದು ಡ್ರಾಪ್ ಡೌನ್ ಬಾಕ್ಸ್ ಇರುತ್ತೆ. ಅಲ್ಲಿ 21 ಡಿಸಬಿಲಿಟಿ ಏನಿರ್ತದೆ ಅದರಲ್ಲಿ ನಾವು ಎಂಟ್ರಿ ಮಾಡುವಾಗ ನಾವು ಯಾವುದು ನಮಗೆ ಅನ್ವಯಿಸುತ್ತೆ ಅದನ್ನ ಕ್ಲಿಕ್ ಮಾಡಿದ್ರೆ ವಿ ವಿಲ್ ಗೆಟ್ ದಟ್ ಆ ಪರ್ಟಿಕ್ಯುಲರ್ ಡಿಸಬಿಲಿಟಿ ಅನ್ನೋದನ್ನ ನಾವು ಇಲ್ಲಿ ಇದು ಮಾಡಬಹುದು. ದೆನ್ ಎಜುಕೇಶನಲ್ ಕ್ವಾಲಿಫಿಕೇಶನ್, ದಿಸ್ ಇಸ್ ಆಲ್ಸೋ ಮೋಸ್ಟ್ ಇಂಪಾರ್ಟೆಂಟ್. ಈಗ ಎಂಪ್ಲಾಯ್ಮೆಂಟ್ ಆಪರ್ಚುನಿಟೀಸ್ ಇದೆ ಗವರ್ಮೆಂಟ್ ಲೆವೆಲ್ ಅಲ್ಲಿ, ಪಬ್ಲಿಕ್ ಸೆಕ್ಟರ್, ಪ್ರೈವೇಟ್ ಸೆಕ್ಟರ್ ಅಲ್ಲಿ. ಸೊ ನಾವು ಇನ್ಫಾರ್ಮೇಶನ್ ನಾವು ಶೇರ್ ಮಾಡ್ಕೊಡ್ತೀವಿ. ಅಲ್ಲಿ ಆ ಡಿಸೇಬಲ್ಸ್ಗೆ ವಾಟ್ ಟೈಪ್ ಆಫ್ ಎಜುಕೇಶನ್ ಅನ್ನೋದನ್ನ ನಾವು ಅಲ್ಲಿ ಸ್ಪೆಸಿಫಿಕ್ ಆಗಿ ಮೆನ್ಷನ್ ಮಾಡ್ತೀವಿ. ಸೊ ವಿ ಕ್ಯಾನ್ ಗೆಟ್ ಈವನ್ ಎಜುಕೇಶನಲ್ ಕ್ವಾಲಿಫಿಕೇಶನ್ ಆಲ್ಸೋ ಇನ್ ದಟ್ ಇದು ಕಾರ್ಡ್ ಅಲ್ಲಿ ಸಿಗ್ಬೋದು ನಮಗೆ. ದೆನ್ ಎಂಪ್ಲಾಯ್ಮೆಂಟ್ ಡೀಟೇಲ್ಸ್, ಈಗ ನಾನು ಈಗಾಗಲೇ ಹೇಳಿದೆ ನಾವು ಯಾವ್ದು ಸ್ಟೇಟ್ ಗೌರ್ಮೆಂಟ್ ಅಥವಾ ಸೆಂಟ್ರಲ್ ಗೌರ್ಮೆಂಟ್ ಅಥವಾ ಪಬ್ಲಿಕ್ ಸೆಕ್ಟರ್ ಅಥವಾ ಬೇರೆ ಯಾವ್ದು ಆಕ್ಯುಪೇಷನ್ ಅವ್ರು ಮಾಡ್ತಾ ಇದ್ದಾರೆ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ಸೆಲೆಕ್ಟ್ ಆಪ್ಷನ್ ಫಾರ್ ಎಂಪ್ಲಾಯ್ಡ್ ಅಂಡ್ ಅನ್ಎಂಪ್ಲಾಯ್ಡ್ ಕನ್ಸರ್ನ್ಡ್ ಇನ್ಫಾರ್ಮೇಶನ್ ನಮಗೆ ತಗೊಳ್ಬಹುದು. ಆಮೇಲೆ ಸೆಲೆಕ್ಟ್ ಆಪ್ಷನ್ ಅಂಡರ್ APL BPL ಅಂತ, ಬಿಲೋ ಪಾವರ್ಟಿ ಲೈನ್ ಅಂಡ್ ಅಬವ್ ಪಾವರ್ಟಿ ಲೈನ್ ಅಂತಕ್ಕಂಥ ಇನ್ಫಾರ್ಮೇಶನ್ ವಿ ಕ್ಯಾನ್ ಸಿ ಇನ್ ದಟ್ ಕಾರ್ಡ್. ಸೊ ಆಮೇಲೆ ನೀವು ಐಡೆಂಟಿಟಿ ಡೀಟೇಲ್ಸ್ ಸಹ ನೀವು ಮೆನ್ಷನ್ ಮಾಡಬಹುದು. ಎಂಟರ್ ಡ್ರೈವಿಂಗ್ ಲೈಸೆನ್ಸ್ ನಂಬರು ಅಂಡ್ ದೆನ್ ಆಧಾರ್ ಕಾರ್ಡ್ ನಂಬರು ಅಂಡ್ ಅದರ್ ಸ್ಟೇಟ್ ID ಡೀಟೇಲ್ಸ್ ಅನ್ನ ನಾವು ಆ ಒಂದು UDID ಕಾರ್ಡ್ ಅಲ್ಲಿ ನಾವು ಮೆನ್ಷನ್ ಅನ್ನ ಮಾಡಿ ನಾವೊಂದು ಯೂನಿಕ್ ಡಿಸಬಿಲಿಟಿ ID ಕಾರ್ಡ್ ಅನ್ನ ನಾವು ಪಡ್ಕೊಳ್ಳೋದಕ್ಕೆ ಅನುಕೂಲ ಆಗ್ತದೆ. ಸೊ ಈಗ ಏನು ಓಲ್ಡ್ ಸಿಸ್ಟಮ್ ಇತ್ತು ನಮ್ದು, ಏನು ಒಂದು ಕಾರ್ಡ್ ರೂಪದಲ್ಲಿ, ಅದಲ್ಲಿ ಸುಮಾರು ಮಾಲ್ ಪ್ರಾಕ್ಟೀಸಸ್ ಮತ್ತೆ ಸುಮಾರು ಎರರ್ಸ್ ಮತ್ತೆ ಕೆಲವೆಲ್ಲ ಡೂಪ್ಲಿಕೇಶನ್ ಈ ರೀತಿ ಆಗ್ತಕ್ಕಂಥ ಒಂದು ಚಾನ್ಸಸ್ ಇದೆ. ಸೊ ನಾವು ಈ ರೀತಿಯಾಗಿರ್ತಕ್ಕಂಥ ಒಂದು UDID ಫೆಸಿಲಿಟೀಸ್ ನಾವು ತಗೊಂಡು ಒಂದು ಸಿಂಗಲ್ ಕಾರ್ಡ್ ಅನ್ನು ತಗೊಂಡ್ರೆ, ಸೊ ಆಲ್ ಓವರ್ ಇಂಡಿಯಾ ವಿ ಕ್ಯಾನ್ ನಾವು ಎಲ್ಲಿ ಬೇಕಾದ್ರೂ ನೋಡ್ಬೋದು. ಯಾಕಂದ್ರೆ ಈವನ್ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ನೀವು ರಾಜಸ್ಥಾನ್ಗೆ ಹೋಗಿ, ಡೆಲ್ಲಿ ಹೋಗಿ, ಅಸ್ಸಾಂಗೆ ಹೋಗಿ, ವಿ ಕ್ಯಾನ್ ಶೋ ದಟ್ UDID ಕಾರ್ಡ್. ಯಾಕಂದ್ರೆ ನಾವು ಆಲ್ ಓವರ್ ಇಂಡಿಯಾ ನಾವು ಎಲ್ಲೇ ನಾವು ಮೂವ್ ಆದ್ರೂ ಸೊ ಸೇಮ್ ಟೈಪ್ ID ಕಾರ್ಡ್ ಅನ್ನ ನಾವು ಯೂಸ್ ಮಾಡಬಹುದು, ಜಸ್ಟ್ ಲೈಕ್ ಎ ಆಧಾರ್ ಕಾರ್ಡ್. ಸೊ ಇದು ನಮಗೆ ನಮ್ಮ ಡಿಸೇಬಲ್ಸ್ಗೆ ಈ ರೀತಿ ಒಂದು ಕಾರ್ಡ್ ಅನ್ನ ಇದ್ರೆ, ಸೊ ಸರ್ಕಾರದಿಂದ ಏನೋ ಒಂದು ಬೆನಿಫಿಟ್ ಸಿಗುತ್ತೆ. ವಿ ಕ್ಯಾನ್ ಅವೈಲ್ ಆಲ್ ಟೈಪ್ ಆಫ್ ಗವರ್ಮೆಂಟ್ ಫೆಸಿಲಿಟೀಸ್ ಫ್ರಮ್ ದಿಸ್ ಕಾರ್ಡ್ಸ್. ಓಕೆ, ಸೊ ದಿಸ್ ಇಸ್ ಸ್ಮಾಲ್ ಇಂಟ್ರೊಡಕ್ಷನ್ ಅಬೌಟ್ ದಿ UDID ಕಾರ್ಡ್.
ಸರ್ ಥ್ಯಾಂಕ್ ಯು ಸರ್. ಈಗ ಡಾಕ್ಟರ್ ರಾಜನಿ ಪಾರ್ಥಸಾರಥಿ ಅವರು ಕೂಡ ಡೆಪ್ಯೂಟಿ ಡೈರೆಕ್ಟರ್ ಆಫ್ ಮೆಂಟಲ್ ಹೆಲ್ತ್ ಅಥಾರಿಟಿ ಇಂದ ಅವರು ಜಾಯ್ನ್ ಆಗಿದ್ದಾರೆ. ಸೊ ನೀವು ಇಂಟ್ರೊಡಕ್ಟರಿ ರಿಮಾರ್ಕ್ಸ್ ನ ಕೊಟ್ಟಿದ್ದೀರಾ. ಥ್ಯಾಂಕ್ಸ್ ಫಾರ್ ದ ಎಕ್ಸ್ಪ್ಲನೇಷನ್ ಸರ್. ಈಗ ಮೋಸ್ಟ್ ಆಫ್ ದ ಕೇರ್ ಗಿವರ್ಸ್ ರೈಸ್ಡ್ some of the caregivers are not equipped with internet literacy equipments ಇರಲ್ಲ. ಅವರು ಎಲ್ಲಿ ರಿಜಿಸ್ಟರ್ ಮಾಡಿಸ್ಕೋಬೇಕು? ಎಲ್ಲಾದ್ರೂ ಗವರ್ಮೆಂಟ್ ಸೆಟಪ್ ಇಂದ ಅಂದ್ರೆ is there any system to support these category of people ಅಂತ ಕೇಳಿದ್ದಾರೆ. ಸೊ
yes, so we have, so district level ಅಲ್ಲಿ ನಮ್ದು district disabled welfare officer ಅಂತ ಹೇಳ್ಬಿಟ್ಟು district level ಅಲ್ಲಿ ಒಂದು ಆರ್ಗನೈಸೇಷನ್ ಸೆಟಪ್ ಇದೆ. ಸೊ in our department, so if you go to the rural as well as urban areas ಹೋದ್ರೆ ನಮ್ಮಲ್ಲಿ VRWOs and URWOs ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ಗ್ರಾಮ ಪಂಚಾಯತ್ ಲೆವೆಲ್ ಮತ್ತೆ ಅರ್ಬನ್ ಬ್ಲಾಕ್ಸ್ ಅಲ್ಲಿ ಸೊ ಅರ್ಬನ್ ರಿಹಾಬಿಲಿಟೇಷನ್ ವರ್ಕರ್ಸ್ ಅಂತ ಇರ್ತಾರೆ. ವಿಲೇಜ್ ಲೆವೆಲ್ ಅಲ್ಲಿ ಬಂದು ವಿಲೇಜ್ ರಿಹಾಬಿಲಿಟೇಷನ್ ಆಫ್ ವರ್ಕರ್ಸ್ ಅಂತ ಇರ್ತಾರೆ. ಆಮೇಲೆ ತಾಲೂಕಾ ಮಟ್ಟದಲ್ಲಿ ನಮ್ಮ MRWs ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ವರ್ಕ್ ಮಾಡ್ತಾ ಇರ್ತಾರೆ. ಸೊ ಅವರ ಒಂದು ಅಸಿಸ್ಟೆನ್ಸ್ ಅನ್ನ ಅಥವಾ ಫೆಸಿಲಿಟೀಸ್ ತಗೊಂಡು ಸೊ ನಮ್ಮವರು ಈ ಒಂದು UDID ಕಾರ್ಡ್ ಮಾಡೋದಿಕ್ಕೆ ಅವ್ರನ್ನ ಎಲ್ಲಿ ಮೀಟ್ ಮಾಡ್ಬೇಕು, ಹೇಗ್ ಮಾಡ್ಬೇಕು, ಸೊ ಇಫ್ ದೇರ್ ಆರ್ ಏನೋ ಕಂಪ್ಯೂಟರ್ ಇಲ್ಲಿಟ್ರೇಟ್ಸ್ ಆಗಿದ್ರೆ ಅವರಿಗೆ ಯಾವ ರೀತಿ ಅಸಿಸ್ಟ್ ಮಾಡಬೇಕು ಅನ್ನೋದನ್ನ ನಮ್ಮ ಒಂದು VRWs ಅಂಡ್ URWs MRWs ಅಸಿಸ್ಟ್ ಮಾಡ್ತಾರೆ. ಅದರ ಮುಖಾಂತರ ನಮ್ಮ ಏನು ಡಿಸೇಬಲ್ಸ್ ಏನಿದ್ದಾರೆ ಈ ಫೆಸಿಲಿಟೀಸ್ ನ ಪಡೆದುಕೊಳ್ಬಹುದು.
ಸರ್ ಸಾರಿ ಟು ಇಂಟರಪ್ಟ್, ಏನ್ ನಿಮ್ಮ ಏನಾದ್ರೂ ಸುತ್ತೋಲೆ ಏನಾದ್ರೂ ಇದೆಯಾ ಸರ್? ನೋಟಿಫಿಕೇಶನ್ MRW VRW ಇದಕ್ಕೆ ಸಂಬಂಧಪಟ್ಟಂತೆ ಸಹಾಯ ಮಾಡಬೇಕು ಅಂತ ಏನಾದ್ರೂ ನಿಮ್ಮ ಕಡೆಯಿಂದ ನಿರ್ದೇಶನಗಳು ಇದೆಯಾ?
ಹೋಗಿದೆಯಾ ಅದು? ಜಾಬ್ ಚಾರ್ಟ್ ಅಲ್ಲಿ ನಾವು ಕೊಟ್ಟಿದೀವಂತೆ ಅದು. ಸೊ ಅದನ್ನ ಅದರ ಪ್ರಕಾರ ಅವರು ಜಾಬ್ ಚಾರ್ಟ್ ಪ್ರಕಾರ ಕೆಲಸ ಮಾಡಬೇಕಾಗ್ತದೆ. ಸೊ ಏನು ಎನಿಥಿಂಗ್ ವಿತ್ ರಿಗಾರ್ಡ್ ಟು ದಿ ಡಿಸೇಬಲ್ಡ್ ಕನ್ಸರ್ನ್, ಸೊ ರೂರಲ್ ಅಂಡ್ ಅರ್ಬನ್ ಏರಿಯಾದಲ್ಲಿ ಅದಕ್ಕಾಗಿ ಅವ್ರು ಕೆಲಸ ಮಾಡಬೇಕಾಗಿರೋದ್ರಿಂದ ಸೊ ದೇ ಕ್ಯಾನ್ ಅಸಿಸ್ಟ್ ದೆಮ್. ಓಕೆ ರೈಟ್.
Sir, Madam Rajini Madam wants to talk anything. Rajini Madam?
Yeah.
Yes.
See, basically there are joint circulars which have been sent from both WCD department and health department. Ivaga innu one more facility what is there in addition to what Muniraju sir told. One is Karnataka is the only state where all the taluka hospitals also are giving UDID cards through medical authorities, and of course district level anyway district hospital medical authorities are there. Now to help those who are not even tech savvy, who can't even upload the details, Seva Sindhu Kendras are there, Bapuji Kendras are there at the panchayat level itself, and then Bangalore one, Karnataka one. So all these places they can just go along with the VRW, MRW or on their own. So there are joint circulars for these from RDPR, WCD and health department. I can WhatsApp you that joint circular. So these are all the things, and many of the people they are uploading the preliminary things, but they are not coming to the hospitals. So doctors are sending SMS, email. I don't know what is going on, what phone numbers they are giving. But after applying, for example, district hospital Haveri or nearby taluka, they apply and they are not going. Almost 2 lakh people, they have not hit the hospital at all. So my request is, there are if they don't know anything, let them just talk to DDWO, Disability Welfare Department Deputy Directors, or VRW, MRW, or urban rehabilitation workers. somebody. Okay, so all of them know that this process is there in place.
Thank you, madam. Madam, actually, this is a whole comprehensive system you have mentioned, but some of the caregivers have mentioned that the time duration 3 to 3 years, 3 weeks to 3 years, still they are not get the UDID certificate and they are waiting. So in they are stuck somewhere. What is the mechanism to sort out this issue?
If you give a specific example, we can discuss, because if it is general, we can tell already we have given 3 lakh cards. So why others are not getting, what is the problem? If you give some 10 specific cases, for example, Bidar, I have applied on this date, so nobody has called, or I went to the Bidar district hospital, nobody responded. So, you know, something like that. You give us some 10 cases wherein we can analyze the issue. See, now, you know, there are many facilities on the ground, and there are facilitators also, and there are many circulars, everything is there. But what is the challenge? Why they are not going to the hospital, or did they go to the hospital? So I think we need little more analysis regarding this issue. We are here to help all of them, and we also want to finish off, you know, the pending UDIDs faster.
Madam, technically, what is the time duration to complete from assessment to convert to UDID?
See, we have given directions to finish off within 4 weeks. Okay, but patient has to, or not patient, the person has to go to the hospital in front of medical authority. So as I told, around 2 weeks back, Muniraju sir was also there. There was a committee meeting where we analyzed the data. 2+ lakh people, they have applied, but they are not coming to the hospital. SMS has been sent, emails have been sent, maybe because of the COVID fear or what, I don't know. Or is the SMS not reaching them? So they can just go to the nearby Taluka hospital or district hospital. Otherwise, after applying, that would be my request.
Madam, actually, some caregivers has asked actually one question. After apply, whether they are going to call, whether we should go reach, they are in the confusion stage. They are
Usually after application, once the medical authority, medical superintendent or district surgeon or administrative medical officer, he opens and sees and sends an SMS for the date, or sends an email, whatever number they have given. By chance, if that has not reached, let them just go after application to the nearby government hospital, either Taluka hospital or the district hospital. That would be the best.
Sure. Sir, this is this question particularly to Muniraj sir. Some of the caregivers has raised their aged parents, and the disability is so severe. So such kind of patients, it's difficult to bring the patient to the hospital. Is there any special arrangement for them? Can we able to help like that? Can you able to give some special priority for us like that? They're asking. Is there any arrangement from your department, sir?
Yes. Certainly, our DDWs, VRWs, and MRWs, so they can help them. Okay, so to assist this kind of transport facility. So through them, they can definitely they can use this kind of facility. Okay.
ಅಂದ್ರೆ ಸ್ಪೆಷಲ್ ಅಂದ್ರೆ ಟೈಮ್ ನ ಕಡಿಮೆ ಮಾಡುವಂತದ್ದು, ಬೇಗ ನೋಡಕ್ ಆಗುತ್ತೋ ಅಥವಾ ಟ್ರಾನ್ಸ್ಪೋರ್ಟ್
ಅಲ್ಲ, ಬಟ್ ನಾನು ಹೇಳ್ತಿರೋದು, ಸೊ ಈ ಸಿವಿಯರ್ ಕೇಸಸ್ ಆರ್ ವೆರಿ ವೆರಿ ಲೆಸ್ ಕಂಪೇರ್ ಟು ದಿ ನಾರ್ಮಲ್ ಕೇಸಸ್, ಇಸ್ಂಟ್ ಇಟ್? ಸೊ ಜಸ್ಟ್ ನಿಮ್ಗೆ ಆ ರೀತಿ ಇರತಕ್ಕಂಥದ್ದು ಬರೀ 1% to 2% ಸಿಗ್ತದೆ ಅಷ್ಟೇ. ಸೊ 99% ದೇ ಕ್ಯಾನ್ ಮೂವ್ ಪ್ರಾಪರ್ಲಿ ಫ್ರಮ್ ಒನ್ ಪ್ಲೇಸ್ ಟು ಅನದರ್ ಪ್ಲೇಸ್. ಓಕೆ, ಸೊ ಇಂಥ ಕೇಸಸ್ ಅಲ್ಲಿ ಏನ್ ಸಮಸ್ಯೆ ಆಗೋದಿಲ್ಲ. ನೀವು ಏನು 1% ಅಂತ ಹೇಳ್ತಿದ್ರಲ್ಲ, ಅಂತ ಒಂದು ಇದಕ್ಕೆ ನಮ್ಮ ಏನು VRWs ಗಮನಕ್ಕೆ ತಗೊಂಬಂದ್ರೆ, ಸೊ ಡೆಫಿನೆಟ್ಲಿ ಅವರು ಹೆಲ್ಪ್ ಮಾಡೇ ಮಾಡ್ತಾರೆ. ಒಂದು ಟ್ರಾನ್ಸ್ಪೋರ್ಟೇಷನ್ ಫೆಸಿಲಿಟೀಸ್ ಆಗಿರ್ಬೋದು ಅಥವಾ ಬೇರೆ ಇನ್ನೇನ ಫೆಸಿಲಿಟೀಸ್ ಆಗಿರ್ಬೋದು, ಅವರು ಹೆಲ್ಪ್ ಮಾಡ್ತಾರೆ. ಸೊ ಅಂತ ಒಂದನ್ನ ಬೆನಿಫಿಟ್ ತಗೊಂಡು ದೇ ಕ್ಯಾನ್ ಗೆಟ್ ದಟ್ ಸೊ UDID card.
Mobility.
Can I make a small remark here?
Yes, sir.
Yes.
Go ahead.
Sir, Dr. Muniraju and Dr. Rajini, I feel that Karnataka and even other states have done a fantastic job. A lot of UDID cards have been issued. There is no doubt about it. In today's session, we are trying to focus on people who are having some challenges in getting the UDID. There is no doubt that a lot of people have received UDID, and I think it has been a tremendous achievement by the government. But we are trying to focus on some very difficult cases. So that is where we are trying to raise issues and not trying to, point out any deficiencies. Some patients have come to us and requested to get some solutions. That's why we are raising these questions. Please don't mistake us.
Okay, no problem. No problem.
I think my Chodi sir has clarified. Thank you, sir. We are appreciating, sir, but at the same time, how to improve further. Madam is smiling. Madam, you are working and sir work is.
No, I accept your positive reinforcement. But we know many things have to be done. But community level, people don't know many services which are available, many facilitators which is not there. I think every place awareness, lack of awareness is also there. And around 2 weeks back, we were even discussing with Principal Secretary WCD. Madam was telling that at the panchayat level itself, also mobility support is there. As you said, for those who are bedridden or severe problem, they can be mobilized to the nearby hospital.
Sure.
So people have to approach the panchayat office or VRW or MRW or URW. So if there is still a problem, they can even call DDWO's office. So they will facilitate. So once they come to the hospital, definitely it is our responsibility, as an institution, that we can take it further and to a logical end.
Sure.
But till they come to the hospital, lot of challenges are there.
Madam, I think some of the caregivers has faced, the medical board rejected the certificate during the assessment itself. So what they feel that
rejected means maybe the rejected in the sense it is less than 40%.
Yes.
Yeah, that is the discretion of a board. I mean medical authority. For example, I have a small cut in the little finger. So you know that it will not quantify. For example, I have 1 day depression after scoring 95 instead of 99. See, that will not come to disability, right? So maybe those are the reasons. I don't know. I assume that is why these may be the reasons why medical authority has rejected. But please give us the specific, complaints so that we can analyze.
No,
There may be genuine reasons also, but I don't know.
Where to apply this kind of appeal? To whom and where?
DHO of the particular district.
Sure.
District health officer.
Okay.
That he can tell. That he can tell. I went to so and so district hospital. I had, I was present in front of the medical authority on such and such a date. I have this amount of disability and my application was rejected. So please look into it. So maybe he will inquire or he can ask the particular doctor himself instead of going and appealing, right? That is even more easier. Instead of DHO going and inquiring with the medical authority why you rejected, the person can ask why you rejected. But now in UDID, when we are rejecting, we have to write the reason.
Reason, correct. You're right. Yes.
So there is no question.
You can't reject it. For that logical reason, they have to.
Now there is no issue. Maybe in the previous manual card, I agree with you. But now if I am rejecting as a medical authority, I have to put the reason, no?
Sure. You're right.
So there will not be any question of rejecting without writing a reason.
So there are 3 levels of authority. So one is taluka level, and then second one is district level, DHO, and the third one is state level.
Yeah.
So they can appeal anywhere, isn't it?
Sure. So they can appeal, sir. But my request is let them discuss with the concerned medical authority.
Exactly.
Innu tumbane avrige grievance ide andre let us address. But most of the time, doctors who are assessing, they will answer the question.
Exactly.
They will not push the people without answering.
Sure.
But if such things happen, yes, they can appeal.
Okay. Madam, one more thing actually leading to this. In UDID, what we are issuing, some caregivers is raised. Can we make it as a universal acceptance in the airport, railway stations, all these things?
No, I think it is. Jagdisha sir, you correct me if I am wrong. It is accepted everywhere. That is the idea.
Yeah, it is.
It is accepted everywhere across the You know,
country.
even across the states.
Across the states. Okay.
Shanivaram, if I may just ask,
They,
are you asking about whether was the question about whether they could be accepted in lieu of railway concession? Was that the question that the caregivers were raising?
no, they are asking on locations like airports, railway, and any other public agencies.
It
Provision
is,
to special privilege with this card.
no, it is accepted everywhere allowed. Special privilege.
ಸ್ಪೆಷಲ್ ಪ್ರಿವಿಲೇಜ್ ಅಂತಂದ್ರೆ ಅವ್ರಿಗೆ ಈಗ ನಾವು ಡಿಸೇಬಿಲಿಟಿಯನ್ನ ಕನ್ಸಿಡರ್ ಮಾಡುವಂಥದ್ದು.
Hello, Muniraju sir can enlighten on this.
Yes. ಈಗ ನೋಡಿ, ಎಕ್ಸೆಪ್ಟ್ ರೈಲ್ವೆ ಇದರಲ್ಲಿ ಸ್ವಲ್ಪ ಅಲ್ಲಿ ಸ್ವಲ್ಪ ಕನ್ಫ್ಯೂಷನ್ ಇದೆ, ಸ್ವಲ್ಪ ಇನ್ನು ಡಿಸ್ಕಷನ್ ನಡೀತಾ ಇದೆ ಇಲ್ವೇನ್ರಿ? ಎಕ್ಸೆಪ್ಟ್ ರೈಲ್ವೆ ಬಿಟ್ಟು ಇನ್ನುಳಿದಿದ್ದು ನೀವು ಏರ್ವೇಸ್ ಆಗಿರ್ಬೋದು, ಮತ್ತೆ ನಮ್ಮ ಬೇರೆ ಬೇರೆ ಇನ್ಯಾವುದೇ ಒಂದು ಗವರ್ಮೆಂಟ್ ಅಥವಾ ಸೆಂಟ್ರಲ್ ಸ್ಟೇಟ್ ಆರ್ ಸೆಂಟ್ರಲ್ KSRTC ಪ್ರೈವೇಟ್ ಆರ್ ಪಬ್ಲಿಕ್ ಸೆಕ್ಟರ್ ಎಲ್ಲಾ ಕಡೆನೂ ಅದು ಅಕ್ಸೆಪ್ಟ್ ಆಗ್ತಿದೆ. ಎಕ್ಸೆಪ್ಟ್ ರೈಲ್ವೆ ಇದರಲ್ಲಿ ಸ್ವಲ್ಪ ಡಿಸ್ಕಷನ್ ಆಗ್ತಾ ಇದೆ. So after discussion, this kind of problem will be solved shortly.
Thank you.
So otherwise, it's accepted in all the.
Thank you for your assurance.
Yes.
Sir, one more thing, we came to know that I think some of specific questions caregivers raised. ಸ್ಪರ್ಶ್ ಅಂತ ಒಂದು ವೆಬ್ಸೈಟ್ ಇದೆ, ಮಧ್ಯಪ್ರದೇಶ್ ಗವರ್ಮೆಂಟ್ ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡಿದ ಸಿಂಗಲ್ ವಿಂಡೋ ಫಾರ್ ಡಿಸೇಬಲ್ ಪೀಪಲ್. ನಾವು ನೋಡಿದ್ವಿ ಆಕ್ಚುಲಿ. ಅದರಲ್ಲಿ ಏನ್ ಮಾಡಿದೆ ಅಂದ್ರೆ ಈ ಡಿಸೇಬಿಲಿಟಿಗೆ ಸಂಬಂಧಪಟ್ಟಂತೆ ಎಲ್ಲಾ ಗ್ರೇವಿನ್ಸಸ್, UDID ಅಪ್ಲೈ ಮಾಡೋದು ಹೆಂಗೆ, ವೆಲ್ಫೇರ್ ಸ್ಕೀಮ್ಸ್, ಎವ್ರಿಥಿಂಗ್ ದೇ ಹ್ಯಾವ್ ಎಕ್ಸ್ಪ್ಲೈನ್ಡ್. ಕೆನ್ ವಿ ಮೇಕ್ ಇಟ್ ಇನ್ ದಿ ಸ್ಟೇಟ್ ಆಫ್ ಕರ್ನಾಟಕ? ಕೆನ್ ವಿ ಫಾಲೋ ಸಚ್ ಕೈಂಡ್ ಆಫ್ ಮಾಡೆಲ್ ಅಂತ ಕೇಳಿದ್ದಾರೆ. ವಾಟ್ ಇಸ್ ಯುವರ್ ಒಪಿನಿಯನ್ ಸರ್?
ನಮ್ಮ ವೆಬ್ಸೈಟ್ ಅಲ್ಲಿ ಡೀಟೇಲ್ಸ್ ಇದೆ. ಬ್ರೀಫ್ ಮಾಡಿ ಸರ್. ನಮ್ದು ಡಿಸೇಬಿಲಿಟಿ ವೆಬ್ಸೈಟ್ ಅಲ್ಲಿ ನಮ್ ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಸ್ಕೀಮ್ಸ್ ಮತ್ತೆ UDID ಹೇಗೆ ಅಪ್ಲೈ ಮಾಡೋದು ಅಂದ್ಬಿಟ್ಟು ಇನ್ಫಾರ್ಮೇಶನ್ ಇದೆ ಸರ್. ನಾನು ಒಂದ್ಸಲಿ ಸ್ಪರ್ಶ್ ವೆಬ್ಸೈಟ್ ನೋಡ್ಬಿಟ್ಟು ಏನಾದ್ರು ಎನೌನ್ಸ್ಮೆಂಟ್ ಮಾಡ್ಕೊಳ್ಳಿದ್ರೆ ಮಾಡ್ಕೊಳ್ತೀವಿ ಸರ್.
ವೆರಿ ಗುಡ್, ವೆರಿ ಗುಡ್.
ವೆಬ್ಸೈಟ್ ಹೇಳ್ಬಿಡಿ ಪುನೀತ್.
ಹಾ ಮೇಡಮ್, ನಾನು ಮೆಸೇಜ್ ಬಾಕ್ಸ್ ಟೈಪ್ ಮಾಡ್ತೀನಿ.
ಅದೆಲ್ಲ ಈಗ. ಸೊ ವೈ ಡೋಂಟ್ ವಿ ಮೆನ್ಷನ್ ಇನ್ ಅವರ್ ವೆಬ್ಸೈಟ್? ಅರ್ಥ ಆಯ್ತಲ್ಲ? ನಮ್ಮ ವೆಬ್ಸೈಟ್ ಅಲ್ಲೇ ಅದಕ್ಕೆ ಸಂಬಂಧಪಟ್ಟಂತೆ ಯಾಕೆ ನಾವು ಒಂದು ಏನು ಅವ್ರು ಹೇಳ್ತಾರೆ ಬೇರೆ ಸ್ಟೇಟ್ ಅಲ್ಲಿ ಒಂದು ಅವೇರ್ನೆಸ್ ಕೊಟ್ಟಿರೋ ಟೈಪ್ ನಮ್ಮ ಒಂದು ವೆಬ್ಸೈಟ್ ಅಲ್ಲಿ ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡಿದ್ನ
ಸ್ಕೀಮ್ಸ್ ಎಲ್ಲ ಮೆನ್ಷನ್ ಆಗಿದೆ.
That's a good idea.
Yes.
Harish want to raise. Harish, can you?
Madam Rajni madam, one of the question that has been asked by some of the caregivers is that SLD is getting certified under UDID. So I think for them, I can just add on a point that yes, SLD is getting certified. Now, the question that I'm also thinking in that regard is that because SLD has to be certified only by a clinical psychologist in the part of the board. Now, when I look at taluk boards or even district boards, I'm just trying to check with you about the availability of the psychologists at the district and taluk boards to assess for specific learning disability or scale for assessment of autism, ISA, or the people from the peripheries would be redirected to the state capital where Victoria has a psychologist available or NIMHANS is available. So if you can throw a little more information about people who are looking at getting this autism certificate or SLD certificate at a district or periphery level, I think that can be a lot of useful for many caregivers who are searching for answers for that.
Yeah, as you rightly said, most of the cases are referred to NIMHANS, Dharwad Institute, and medical colleges where clinical psychologists are there. As you know, we have 18 medical colleges now, and those are the places where it is being certified right now, where there is clinical psychologist for assessment. NIMHANS, DIMHANS, and medical colleges. And also,
Madam, in a place like Shimoga, there is a Shimoga Institute of Medical Sciences, but there is no clinical psychologist there.
So I think they are referring to. I'll ask specifically few more districts also what they are doing, but as far as I know, they are referred to the place where
the point that I am trying to say. The point that I am trying to say is that even in government medical colleges, some colleges or most colleges do not have MPhil qualified clinical psychologist who is expected to do this work. So it will be useful if you can send us a list of colleges where MPhil qualified clinical psychologist is there, so that we can easily refer them to
Medical college we have to take from medical education department, sir.
I see.
Our hospitals, I don't think so anybody is there, MPhil.
But if they
Health
are
and
there in
family
medical
welfare.
colleges, if they are there in medical colleges, can they be part of the board? Can I?
Yeah. Medical colleges, all the medical colleges have the board with them only, sir.
Okay. So they are disability.
Yeah.
So boards are there in the medical colleges.
Yes. Medical
Okay.
superintendent is the chairman of the medical authority there. All the medical colleges.
Whom should we approach to know clinical psychologists availability in medical colleges?
Director medical education or RGHS can give the data, sir.
Thank you.
Now it leads to technical related questions. I think Arish is going to continue the further.
Sorry, Reddy, to interrupt you. Just one more question to Madam. I think Madam also hinted that she may have other meetings. So, Madam, I think earlier also I had a chat about this one, but I think for caregivers use, continuing the same question that the delay between application and certification, as there are some people who mentioned that they were expecting a call from one or other authority, but they did not receive any call. So there appears to be some kind of communication gap after submission of application, whatever the reason. Now, my question is there any identified nodal officer mechanism through which they can approach? In the districts, it is easy that district hospital or district medical officer is the in charge for entire district. But in Bangalore, say there are 8 or 10 hospitals identified for issuing disability certificates and where they should go. So is there any kind of identified nodal officer with which they can approach, saying that we have applied long time back, but we did not get any reply?
Yeah. See, basically, once they apply, it is mechanism what is there in place is the list has to go to DDWO, District Disability Welfare Officer, and through DDWO, it has to be intimated to VRW, MRW, and they have to intimate to the person who has applied. But I don't know how efficiently the pathway is working. So that's why I requested that we have found that SMS is being sent and emails are being sent from the hospital. There is no one person sitting in the hospital who is calling these people who have applied. So they are sending SMS and email, but I don't think so it is reached or it has not reached. So 2 lakh people have not hit the hospitals after applying. So it's best that they can go directly to the Taluka hospital or district hospital once they apply.
In case of Bangalore also, you would suggest that because there are 9-10 separate hospitals, like for example, eye hospital is separate, whereas orthopedic hospital is separate, where are no single, there are very few hospitals where all boards are available.
Yeah. So Puneet, can we just put in your website that which are the hospitals where medical authority is established so that they can go to the nearby hospital in their area? So will that help, sir? Dr. Jagdisha, sir?
In the acknowledgement itself, it is specified, ma'am. All the 13 hospitals are mentioned in the acknowledgement.
Website.
In the acknowledgement, the printout which they take after applying.
No. The question is, if a person applies in Bangalore, he doesn't know where his application will go to which hospital. So, which hospital should he approach? The patients or the applicants will not know. That is the issue. Is there if you suggest one nodal person, that will be helpful.
Sir, I think for this also we had written a letter to Government of India, MOSJE, that they should map the applications to the hospitals. But there is no such mechanism has happened. We have written multiple letters to them. So, for example, Bangalore itself, we have given them an example that we have 12 hospitals or more than that. But once the person applies, he doesn't know where he is applying and who has to call him, where he has to go. So this problem exists even till today. I request Disability Welfare Department to meticulously follow up this with MOSJE, that some kind of mapping should happen and the person should get a message back in the mobile number what he has given that you go to this hospital. unless MOSJE or Ministry of Social Justice Empowerment, in their background software, they map the hospital to the application, it is going to be a very difficult task. So because bringing the patient to the hospital, doctors are not able to do. So that is given, the responsibility is given to the Disability Welfare Department. So I request somebody from Disability Welfare Department to respond on this.
And regarding this, only in Bangalore we are facing this kind of issue, because in all the other districts we have only district hospitals, and in the taluk we are having taluk hospitals. In Bangalore, they can visit any nearby hospitals. In the acknowledgement, all the 13 hospitals list will be printed. So,
No, but that is very difficult. How will he go there? Whom will he apply? For example, NIMANS is such a big institution. First time if you go to NIMANS, it is very difficult for you to find out Dr. Jagdisha sir, where he is sitting. Okay. So it is not easy. And that too, Bangalore hospitals are so big. Victoria Hospital, where will you go and search for the medical authority? And many people, you know, if you go to some physiology department and ask where is the medical authority, they will ask what is medical authority. The doctors that will be difficult. So you please follow up. The moment some application is given, it has to be mapped to a hospital and some contact person in the hospital.
A person with visual impairment would have applied. He doesn't get any response.
Correct.
If you are saying that he can go to any hospital, he cannot come to NIMHANS, right? He has to go to a eye hospital. So I think if he doesn't get any response, if there is a single person whom he should approach, that will be helpful, is what we are trying to suggest.
No, I totally agree, because if somebody applies and they don't know, they can't go to 13 hospitals one by one, and they can't ask, you know, they don't even know. Yeah, single contact number and at least mapping if they can't do the single contact number.
Dr. Srinivas Murthy, sir, you wanted to say something?
Yeah, please, sir.
Sir, unmute. You are muted. Unmute and talk.
Yeah, I wanted to thank you very much. It's a very useful thing. I want to bring to the attention of Mr. Muniraju and the team. In Madhya Pradesh, they have a program called Sparsh. This was awarded the National Award for using IT technology for disability persons in 2013. Like, I used to go to Bhopal regularly and I went and saw that, where the whole certification team goes to a particular community and everyone who is in that community can utilize it. What happens, very briefly, if you go to their website, you get all the details. Anyone can apply. When there are sufficient number of them in a particular area, the whole team goes there, finishes off the whole thing in one day, and the benefit starts from the next day, including giving a kit for each person depending on their disability. My request is, we must become user-friendly. Already we have a model which has been done by a neighboring state, and I think someone should examine it and think of doing it that way rather than making people run around from here to there. See, having a disabled child or a disabled person or disability is a liability for the person and the family. And the government should do everything possible to make it better for them by these mechanisms. I'll be very happy to put in touch with the MP people if you want, because I used to know them very well. Thank you very much.
Sir, actually in Karnataka also, we were doing camps like this till 2019. But after the UDID cards, we have stopped this camp approach because it is completely online. So just wanted to know if they are doing the same community camp approach even now.
No, see, what they do is that you do the online. When sufficient number of them are there, say for example in Jayanagar, there are about 50 people who have applied.
I understood, sir. Are they doing it now also?
I don't know. I have stopped going there for a couple of years. So it can be found out from the director of welfare. I don't know the current situation, but I know very well. I saw some of them when I was there in Bhopal. I used to go there. Thank you very much.
Same thing we were doing till 2019, sir. Only after that we have stopped. Anyway, we can find out whether they are doing something like that now also.
Arish?
Harish.
Shalivar, can I ask a related question to this, if possible?
Go ahead.
I just wanted to I just wanted to confirm with Mr. Puneet about whether when an acknowledgement slip is issued, the hospitals on that list are the list of all the hospitals or the list of the hospitals which contain the board that is relevant to the person, is what I wanted to check with Mr. Puneet.
Sir, the application is divided district wise. So when the application is applied in Bangalore, so all the medical boards in the Bangalore are displayed over there, sir. All the hospitals which issues UDID card will be displayed there.
So including the boards which may not be relevant to that person.
Yes, because applications are divided based on the districts, so it will be included, sir.
Okay.
Related to, I think, Rajni madam as well as for director, see, in Nimans we have started information center. Overall, want some kind of information. We are up to 1:30. We are able to provide information from 9:30 to 1:30. One dedicated person is there, and they are trying to help sometimes for uploading documents for UDID. So, is there any mechanism in the district level and taluka level? So, some of the caregivers has raised this question. ಪುನೀತ್ ಆತರ ಮೆಕ್ಯಾನಿಸಮ್ ಇದೆಯಾ ಅಂತ ಮುನ್ರಾಜ್ ಸರ್ ಕೇಳ್ತೀರಾ, ಇದೆಯಾ?
ಕ್ವಶನ್ ರಿಪೀಟ್ ಮಾಡಿ ಸರ್.
ನಿಮ್ಹಾನ್ಸ್ ಅಲ್ಲಿ ಒಂದು ಸಿಸ್ಟಮ್ ವಿ ಹ್ಯಾವ್ ಡೆವಲಪ್ಡ್, ಒನ್ ಇನ್ಫಾರ್ಮೇಶನ್ ಸೆಂಟರ್ ವಿ ಹ್ಯಾವ್ ಸ್ಟಾರ್ಟೆಡ್. ಕೆಲವರಿಗೆ ಆಕ್ಚುಲಿ ಪೇಷಂಟ್ಸ್ ಅಪ್ಲೋಡ್ ಮಾಡಕ್ಕೆ ಅಥವಾ ಹಣ ಇರೋದಿಲ್ಲ, ಏನೋ ಸಮ್ ರೀಸನ್ ಇರುತ್ತೆ. ಇಫ್ ದೇ ಅಪ್ರೋಚ್ ಅಸ್, we will also provide information. Sometimes if they required, we are also helping them to upload the documents for applying the disability UDID card. Is there any such kind of mechanism in the district and taluka level?
Yes, sir. Taluka level, Gram Panchayat level, sir. For example, VRWs on the village rehab workers, taluka level, multiple rehab workers, urban rehab workers of the URW. So you move jana Gram Panchayat over there, sir. If they approach them, they will help us to upload the documents as well as they will tell the steps what to be followed. Or is there, sir? Guide ಮಾಡ್ತಾರೆ.
So how do we get that information? Who is a VRW? Who is a URW in Bangalore? How can a person with disability get this information? Can you help us? It will be very useful.
ವೆರಿ ಪ್ರಾಕ್ಟಿಕಲ್. ಯಾರಾದ್ರೂ ಈಗ ಒಂದು ರಾಯಚೂರಿಂದ ನನ್ಗೆ ಪೇಷಂಟ್ ಬಂದಿರ್ತಾರೆ, ಅಥವಾ ಚಿಕ್ಕಬಳ್ಳಾಪುರದಿಂದ ಬಂದಿರ್ತಾರೆ, ಅಥವಾ ಗುಡಿಬಂಡೆಯಿಂದ ಬಂದಿರ್ತಾರೆ, ನಾನು ಹೆಂಗೆ ಅವ್ರಿಗೆ ಆಕ್ಚುಲಿ ಹೌ ಐ ಕ್ಯಾನ್ ಗಿವ್ ಎಕ್ಸಾಕ್ಟ್ ಇನ್ಫಾರ್ಮೇಶನ್, ಯು ಶುಡ್ ಮೀಟ್ ಅಂಡ್ ಯು ಶುಡ್ ಕಾಲ್ ಆತರ ಸರ್ ಕೇಳ್ತಾರೆ.
ನಿಮ್ಮ ವೆಬ್ಸೈಟ್ ಅಲ್ಲಿ ಇದೆಯಾ ಜಿಲ್ಲೆವಾರು ಅಥವಾ ತಾಲೂಕವಾರು VRW MRW ಲಿಸ್ಟ್?
ಮೇಡಮ್ ಇಲ್ಲ, ಜಿಲ್ಲೆವಾರು DWS ನಂಬರ್ ಇದೆ, ಅವ್ರು ಕಾಂಟ್ಯಾಕ್ಟ್ ಮಾಡಿದ್ರೆ
ಅದನ್ನ ಹಾಕಿದೀರಾ ಅಲ್ಲಿ ಕಾಂಟ್ಯಾಕ್ಟ್ ಮಾಡಿ ಅಂತ?
ಹೌದು ಮೇಡಮ್, DWS ನಂಬರ್ ಇದೆ.
ಓಕೆ, ನೋ ಅದು ಸಾಧ್ಯ ಇಲ್ವಾ? ಅದು VRW MRW
ಹಾಕೋದು ಮ್ಯಾಮ್, ಅದು ನೆಕ್ಸ್ಟ್ ಈಗ ವೆಬ್ಸೈಟ್
ಅದು ಹಾಕಿದ್ರೆ, ಸೊ ಪ್ಲೀಸ್ ಕಾಂಟ್ಯಾಕ್ಟ್ ಯುವರ್ ಏರಿಯಾ VRW MRW URW ಅಂದ್ರೆ ಅವರು ಹೋಗಿ ಅಟ್ ಲೀಸ್ಟ್ ಕಾಲ್ ಮಾಡಿ ಕಾಂಟ್ಯಾಕ್ಟ್ ಮಾಡ್ತಾರೆ. ಅದರ್ವೈಸ್ ಬ್ಯಾಂಗ್ಳೂರ್ ಅಂತ ದೊಡ್ಡ ಸಿಟಿ ಆರ್ ಈವನ್ ಬೆಲ್ಗಾಂ, ತುಮಕೂರ್, ಇಟ್ ಈಸ್ ವೆರಿ ಡಿಫಿಕಲ್ಟ್ ಟು ಸರ್ಚ್, ಗೋ ಅಂಡ್ ಸರ್ಚ್ ಫಾರ್ VRW.
Okay. Sir, this is particularly for the director of disability. So some of the insurance schemes ಏನಿದೆ, so this is many caregivers has difficulty to utilize the insurance schemes. So whom should they approach if they are having the problem?
Sorry, at the district level, if they have any problem, district disabled officer will be available at the office. So if they contact them, what are the insurance available and what are the benefits available for them will be explained for this, sir. So your voice mute agide. Cheniaram sir, your voice mute agide.
Sorry. So some ಪುನೀತ್, ಇದು ನಿಮಗೆ ನೇರ ಪ್ರಶ್ನೆ. ಕೆಲವರಿಗೆ ಆಧಾರ್ ಇರಲ್ಲ, even some patient doesn't have Aadhaar enrollment number also. Such kind of patient, what are the other documents they need to upload ಅಂತ ಕೇಳಿದ್ದಾರೆ.
ಸರ್, ಈಗ ನಮ್ದು ವೆಬ್ಸೈಟ್ ಅಲ್ಲಿ ಒಂದು ಲಿಸ್ಟ್ ಆಫ್ ಡಾಕ್ಯುಮೆಂಟ್ಸ್ ಇದೆ. ಸೊ ಆಧಾರ್ ಮತ್ತೆ ಐಡೆಂಟಿಟಿ ಪ್ರೂಫ್ ಗೆ ಅದರಲ್ಲಿ ಎನಿಥಿಂಗ್ ಅಟ್ಲೀಸ್ಟ್ ಇಲ್ಲ ಗೆಜೆಟೆಡ್ ಆಫೀಸರ್ ಇಂದ ಸೈನ್ ಹಾಕ್ಸ್ಕೊಂಡ್ರೆ ಅಡ್ರೆಸ್ ಪ್ರೂಫ್ ಸಿಗುತ್ತೆ, ಐಡೆಂಟಿಟಿ ಪ್ರೂಫ್ ಅಲ್ಲೂ ಹಾಕೋಬಹುದು ಸರ್. ಈಗ ಲಿಸ್ಟ್ ಆಫ್ ಇದೆ ಸರ್ ವೆಬ್ಸೈಟ್ ಅಪ್ಲೋಡ್ ಮಾಡ್ಬೇಕಾರೆ. ಸೊ ರೇಷನ್ ಕಾರ್ಡ್, ಆಧಾರ್ ಕಾರ್ಡ್, ಆಮೇಲೆ ವೋಟರ್ ಐಡಿ, ಡ್ರೈವಿಂಗ್ ಲೈಸೆನ್ಸ್, ಆಮೇಲೆ ಗೆಜೆಟೆಡ್ ಆಫೀಸರ್ಸ್ ಇಂದ ಸೀಲ್ ಸಿಗ್ನೇಚರ್ ಅಥವಾ VA, ಗ್ರಾಮ ಪಂಚಾಯತಿ, ಸೊ ಅವ್ರ ಎನಿ ಒನ್ ಡಾಕ್ಯುಮೆಂಟ್ಸ್ ದೇ ಕ್ಯಾನ್ ಅಪ್ಲೋಡ್ ಇಟ್ ಸರ್.
Okay, okay. Harish, you want to ask any further question?
Yeah, I think one just continuation of that to Puneet. Some of the questions raised by some family caregivers is that how they can modify some of the details that they enter during the application, like they would enter wrongly either date of birth or some kind of name spelling, or it can be address, or after submitting an application their address would change. So these different kinds of concerns have been raised by family caregivers, that after they submit the application and the acknowledgement is raised, if they want to change the details, what is the process, and what is the process for changing the details after certificate is issued? When they get a UDID card, then they will see that there is some small spelling mistake, or they would change from one place to other place. So they want to get the address with the new place. So there are two parts this question, Puneet. I just wanted you, if you can address, that is change of details before UDID generation, change of details after UDID generation.
Sir, for the first question, after applying the UDID card, still they have not visited the medical board. They have not appeared for the medical board. In that the case, in the website, we have an option for login. In the besides the register option, you have an option for login. There you can enter the enrollment number and date of birth, and you can get login, and you have an option called update personal profile. So everything you can edit over there before medical board has been done. So in that case, anything documents or else any date of birth or any mistakes, they can upload and they can do correction and they can take a printout. So once the application is forwarded to the medical board and medical board has generated the UDID card, so if they have any corrections in the spelling mistakes, or else if they want to do address corrections, if that is the case, they have to contact hospital itself. Till now, the government of India has not made any provision for address change or anything to do correction at the public end. So they have to visit the hospital. So hospital persons, they will reopen the application and they will edit whatever the document based on the document proof, and they will process it again. So the original card will come by post again for them, sir. So before medical board, applicant has the provision for correction. Once the card has been generated, hospitals has the provision for correction.
Thank you, Umesh. I think one of the additional question, I think Dr. Muniraju sir can perhaps throw some light. The same thing that we have discussed a little earlier is that one of the challenge that many people had raised is that related to coordination in terms of facilitating people's visit to the hospital. So one of the identified mechanism, it seems VRW, MRW, and urban
URW. Yes.
But if there is any material with details of who are these people, how to contact them. For example, I am in this hospital for last 5 years, and myself, I am not familiar with who are the urban rehabilitation workers in Bangalore. So I think it is not available readily in any website form. So if you can consider making such details available at a publicly accessible place or at any particularly identified nodal person, I think that could address many of these coordination issues which people are facing, as well as for us also it will be helpful that we will redirect that this is the place where you can go and they can facilitate further.
Okay, we will furnish all these details. Okay.
Thank you,
okay,
sir.
The name of the VRW, URW, and MRW. Okay. So in different areas, no. So what type of even VRWs and URWs are available, and how can we get their facilities from them, and then so area wise we can furnish all the details. So okay, so through this information we can publish I think in website announcement. We will announce in our website also. Okay.
It's good, sir.
Thank you.
Good.
Right.
Thank you. Just an additional, sir, in a similar line. I think Dr. Reddy also had asked this question in the past, but in a different way. I'm just wondering, the question raised by one family caregiver is that if the certificate is rejected on the grounds that the disability is less than 40%, now the software appears does not allow a second application. So the question that is asked is that, can he apply online once UDID is rejected through UDID portal, Swavalaman card portal itself? Because there is no provision for reapplication in the software, is what somebody has asked.
Any option?
Yes, sir. If you send the first application details, we'll make sure it will be reset and the same application will be processed again. So there is no need to apply again, sir. So we'll reset the application of which has been rejected. So with same application can be processed again.
They have to log in again, and there will be
no. If you send the details of the rejected application, I'll inform to a Delhi team and they will reset it again. So same application can be processed from the beginning.
So people who got applications rejected, they should approach you for submission of application.
Yes, sir. At least they can send from the medical board for us.
Okay. So they cannot do anything from their end on the portal itself.
No, sir, they cannot do.
Right.
Sir, Harish, can I just add something to that?
Please.
Possible?
Yes. Go ahead.
Sir, I wanted to make a request to Mr. Muniraju and Dr. Muniraju and his team and Puneet that people may become disabled or more disabled at various points in their lives. In fact, even the disability itself may become more over time, and they may need to be reassessed over time. So the possibility that people will need multiple assessments is there. So I request again that whether this option can be made easier. That is, whether somebody can reapply website, whether this can be correct software rather than making the people approach a higher authority to reapply.
Sir, for this question, if the medical board give him a permanent disability, so the card will be for lifetime. If the medical board thinks that the percentage may increase or decrease for some time, so they will give at some temporary and give for 3 years or 5 years. So once the term is completed, he can apply for renewal and come again to medical board. So the assessment will be done and new card will be generated, sir.
No. What Deepak is saying is that suppose the percentage is 35% and hence it is rejected. What Deepak is saying that after some time, the same applicant's disability can become 50% or 60%. At that time, he has to reapply. And because reapplication is very difficult, he is suggesting that there should be a mechanism of making it easy instead of asking
user friendly. Okay.
And you telling the Delhi people to let the person do it. That is the message that Dr. Deepak is trying to.
Yes, sir. We are asking them for make provision for address corrections and name correction other than percentage and disability type. So if they want to update some personal information like a name and all, we are asking provision for that. If the provision is allowed, then it will be easier for us, sir.
Harish, in the chat box, some of the questions raised. Karthik, can you be able to?
Karthik.
Is there Karthik?
Yes, sir.
Yeah. Can you?
So one of the questions is after the application is made, it was mentioned that list of hospitals will be displayed. So the query the caregiver has is, can we visit one closest or do we have to take an appointment?
The appointment is not required, so you can visit the hospital at any time.
Okay. Yeah. They go to the next.
So 1 second here. I think I don't know, madam still is there, Rajni madam, but some of the times some medical professionals would like to have a registration with their own hospital before assessment. So without appointment, if they just walk into the hospitals with e-acknowledgement that I had registered for UDID, kindly issue a disability certificate. Now that might be some challenge for some medical authorities. Especially I can say that NIMHANS would like to certify people who are registered and evaluated. If they walk in with just UDID and without registration at NIMHANS, it's not feasible for assessment and uploading the data in online. So the question is, I think whether they should visit a nearby hospital or the hospital which would do that, and by taking an appointment, I think also is relevant. Madam Rajni Madam, if she is still there, she can.
Harish, I didn't get you properly. What you said is, if they directly barge into the hospital, it will be difficult for the authority to evaluate. Instead, let them take appointment and come back. Is that what you meant?
The question that caregiver asked is that can they walk in with just a UDID without appointment, or they should make an appointment after you acknowledgement receipt generation?
After receipt generation. After
Yes,
receipt generation,
yes,
UDID will be UDID will be issued only after the medical authority evaluation. If they directly come with the old card, manual card, that may be difficult. So let them apply online and then come with the acknowledgement. That is better.
I think I might have phrased it in a different way. The question is, madam, somebody has applied, they have got a e-acknowledgement. So before going to the hospital, should they make an appointment that on which day should I come? Or
That is
the best.
That is the best
appointment. You would suggest that they should make an appointment before walking.
Yeah. Because, for example, somebody has an orthopedic disability and they directly, today they apply and tomorrow they go to the nearby taluka hospital or district hospital. We don't know whether the orthopedic surgeon is available or not, whether he has gone to OT, whether he is on leave. So that is, it is difficult for the patient to go unnecessarily repeatedly. So they can just take an appointment and go to the nearby hospital with the appointment. That would be better. I don't know whether I answered your question.
Yes, ma'am. Yes, I think because Puneet had suggested that people also can walk in. I just thought of we will add this.
So if they walk in, that is a problem. Better that, one of the persons can, a family member who is in a good condition can go just seek appointment and then take the persons with disability on that day when the medical authority is there or the concerned doctor is there.
Madam Rajani Madam, in the taluka level and the district level, is there any coordinator for this UDID?
DDWO only.
No.
From the hospital side.
Hospital side, for example, in NIMHANS, one person is coordinating. So like that, in the district and the taluka level, can they
program
contact a single person for collecting information, all those things? Probably they are coordinating. If we collect such data and if we circulate, that's going to be useful for many caregivers.
We'll just check how it is going on, and maybe I will get back to you on that.
Sure. Thank you.
Okay.
Ready? Just to I think, sir, Muniraju sir.
Yes.
There is a question by somebody who said that there are some NGO homes where there are some group of people who are residing. So it can be even 30 people or 40 people. So they are asking, is there any possibility that any kind of special arrangements can be made for some kind of group assessments rather than when they do have very less resources to make transport arrangements for those people, and whether they can get any additional help in conversion of the certificates earlier, which were issued in a yellow booklet form to the UDID format in bulk, because which have been issued a long time back, because the validity is also one issue. When it is issued 10 years back, it may not be simply verified by the medical authorities. So sometimes they would like to reassess. So do you have any suggestions or options for these kind of people where some group of people are there, including our own social service complex where 60-70 people are there?
In the discussion,
Sir, since for assessment, technical issues are like equipments are required for assessment, so it cannot be carried over there. They have to come before the medical board, sir. Maybe Rajini madam can suggest for this. Because assessment only for assessments, for example, if they have some eye issues or else some they need equipments for the checkup. So equipments cannot be carried to their home places. So if they we can help them for transportation to coming to the hospital. So in the hospitals they can have assessment and they can get approved.
Puneet, one actually here Mr. Umesh is there. I think Superintendent of Social Service Complex. He has raised many times related to this issue. Umesh sir, can you raise your concern, because many of your inmates are severely disabled. Nim concern enadu idya ee forum alli? ನಾನು ನೀವು ಮ್ಯೂಟ್ ಮಾಡಿದ್ದೀರಾ, ಪ್ಲೀಸ್ ಅನ್ಮ್ಯೂಟ್ ಅಂತ.
ಸರ್ ನಮಸ್ಕಾರ ಸರ್. ಸರ್ ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ.
ಎಸ್ ಸರ್, ಗೋ ಅಹೆಡ್.
ಸರ್ ಈಗ ನಮ್ಮ ಸೋಷಿಯಲ್ ಸರ್ವಿಸ್ ಕಾಂಪ್ಲೆಕ್ಸ್ ಅಲ್ಲಿ ನಮ್ಮ ನಿಮಾನ್ಸ್ ವತಿಯಿಂದನೇ ನಿಮಾನ್ಸ್ ಡಾಕ್ಟರ್ಸ್ ಬಂದು ಅಸೆಸ್ಮೆಂಟ್ ಎಲ್ಲ ಮಾಡಿದ್ದಾರೆ ಸರ್. 2 ಸರಿ ಅಥವಾ 3 ಸರಿ ಅಸೆಸ್ಮೆಂಟ್ ಮಾಡಿದ್ದಾರೆ. ಏನು ಬದಲಾವಣೆ ಇಲ್ಲ. ಒಬ್ಬರು ಅಥವಾ 3 ಮಾತ್ರ ಅಸೆಸ್ಮೆಂಟ್ ಅಲ್ಲಿ ಸ್ವಲ್ಪ ವೇರಿಯೇಷನ್ ಇದೆ, ಇಂಪ್ರೂವ್ಮೆಂಟ್ಸ್ ಇದೆ. ಆ ಇಂಪ್ರೂವ್ಮೆಂಟ್ಸ್ ಇರೋರ ಬಗ್ಗೆನೂ ಅದು ನೋಟ್ ಮಾಡಿದ್ದಾರೆ ನಿಮಾನ್ಸ್ ಡಾಕ್ಟರ್ಗಳು. ಆದ್ರೆ ಅವ್ರಿಗೆ ಯಾವ ತರ ರಿಹ್ಯಾಬ್ ಮಾಡಬೇಕು ಫರ್ದರ್ ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ನಮ್ಮಲ್ಲಿ ಯಾವ್ದು ಸ್ಕೀಮ್ ಇಲ್ಲ. ಅಥವಾ ಅವ್ರನ್ನ ಹೊರಗಡೆ ಕಳ್ಸೋದಾಗ್ಲಿ ಅಥವಾ ಹೊರಗಡೆ ಏನಾದ್ರು ಟ್ರೈನಿಂಗ್ ಮಾಡ್ತಾರೆ, ಸ್ವಂತ ಉದ್ಯೋಗ ಮಾಡ್ತಾರೆ ಅನ್ಲಿಕ್ಕಾಗ್ಲಿ ನಮ್ಮಲ್ಲಿ ಆ ತರ ಫೆಸಿಲಿಟಿ ಅಥವಾ ಪ್ರಾವಿಷನ್ ಇಲ್ಲ. ಇದ್ರನ್ನ ತಮ್ಮ ಬಗ್ಗೆ ಮತ್ತೆ ಹರೀಶ್ ಅವ್ರ ಹತ್ರ 2-3 ಸಾರಿ ಚರ್ಚೆನೂ ಮಾಡಿದ್ದೇವೆ. ನಾವು ಏನ್ ಮಾಡ್ಬೋದು ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ತಾವು ಒಂದು ಆಕ್ಷನ್ ಪ್ಲಾನ್ ಮಾಡ್ತೀವಿ ಅಂತ ಸಹ ಹೇಳಿದ್ರಿ. ಹಾಗಾಗಿ ತಮ್ಮಿಂದ ಏನಾದ್ರು ಬಂತು ಅಂತಂದ್ರೆ ನಮ್ಮ ಸಾಹೇಬ್ರಿದ್ದಾರೆ, ನಮ್ಮ ಸಾಹೇಬ್ರ ಮುಖಾಂತರ ನಮ್ಮ ಮನೆ ನಿರ್ದೇಶಕರ ಮೂಲಕ ಇದನ್ನೆಲ್ಲ ಇಂಪ್ಲಿಮೆಂಟ್ ಮಾಡಬಹುದು ಅಂತ ನನ್ನ ಅನಿಸಿಕೆ ಸರ್.
ಅಲ್ಲಲ್ಲ, ನಾನು ಕೇಳಿದ ಪರ್ಟಿಕ್ಯುಲರ್ಲಿ ಈ ಅಸೆಸ್ಮೆಂಟ್ ಬಗ್ಗೆ ನಿಮ್ಮ ಅಭಿಪ್ರಾಯ ಏನು
ಸರ್? ಈಗ ಅಸೆಸ್ಮೆಂಟ್ ಏನ್ ಮಾಡಿದ್ರು ಸಹಿತ ಅಸೆಸ್ಮೆಂಟ್ ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಆಗೋದು ಒಬ್ರು ಅಥವಾ ಇಬ್ರಲ್ಲಿ ಮಾತ್ರ ಆಗ್ತದೆ.
ಸರಿ ಸರಿ.
ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಈಗ ಒಂದು ಸಿದ್ದಪ್ಪ ಅಂತ ಹೇಳಿ ಒಂದು ಈಗ ತಾವೀಗ ಒಂದು 3-4 ತಿಂಗಳಿಂದ ರಿಅಸೆಸ್ಮೆಂಟ್ ತಾವೇ ಮಾಡ್ಕೊಡ್ತಿದ್ದೀರಿ. ಅವ್ರು ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಇದಾರೆ, ಹೊರಗಡೆ ಇದಾರೆ, ಸ್ವತಂತ್ರವಾಗಿ ಜೀವನ ಮಾಡಬಲ್ಲರು ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಆ ತರದ ಕೇಸಸ್ ನಮ್ಮಲ್ಲಿ 81 ಜನದ ಪೈಕಿ ಆತ ಒಬ್ಬರಿಗೆ ಮಾತ್ರ ಇದೆ, ಇನ್ನು ಉಳಿದಂತೆ ಇಲ್ಲ ಸರ್.
ಥ್ಯಾಂಕ್ ಯು ಉಮೇಶ್.
ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು.
Karthik, is there any other questions?
Yes, sir. So one question is, if I have a valid disability certificate from Victoria but taking treatment from NIMHANS, so can UDID be generated at NIMHANS if I submit the application at NIMHANS?
Puneet, can you respond for this?
ತಗೋಬಹುದು, ಏನ್ ತೊಂದರೆ ಇಲ್ಲ. ಬ್ಯಾಂಗ್ಳೂರ್ ಅಪ್ಲೈ ಮಾಡೋದು ಯಾವ ಹಾಸ್ಪಿಟಲ್ ಅಸೆಸ್ಮೆಂಟ್ ಮಾಡಿ ತಗೋಬಹುದು ಸರ್.
No, I don't know. I mean, Reddy, it is a question that NIMHANS people only will have to answer. So
yeah, the assessment will be done at the hospital. If the issue, the world disability certificate issued at Victoria, and if you go for NIMHANS, of course they will do assessment and they will generate the card. If you are having a disability certificate also, they will do assessment, sir.
Jagdish sir, you want to answer?
No. I think the question that he is asking, I don't think Mr. Puneet or anybody else can answer. It is only NIMHANS people who have to answer.
So, okay. Now I am asking to you, we should answer.
No, see, if some other medical board has certified a certificate, you are asking NIMHANS people to verify it, isn't it? It is a somebody has uploaded a old certificate, and the request is to issue a UDID based on the old certificate. I don't think NIMHANS will agree to issue a UDID certificate based on the disability that has been certified elsewhere. Harish, am I right?
Partially, yes, sir. But yes.
Yeah. So what NIMHANS may do is that you come get evaluated from our own side, and we will issue a new one.
Sir, this is applicable for other disability also. For example, neurological conditions also.
Everything.
Hello.
All disabilities.
Yes. Okay.
Can I come in, please? Hello.
So another question is, if the online tracking shows dispatched and it hasn't arrived for a while, what is the next step that can be taken to get the hard copy?
Sir, for this, you can send the details to the district office so that your card has not been received. So we will send the details to print agency again and make sure you will get a card from the post.
Puneet, can you clarify whether I'm right or not? So can they able to download through DigiLocker this UDID card?
Yes, sir. The option is available in DigiLocker also.
So they can download.
Yeah, you can download in our website itself, sir. You can in the savalamban.com. So if you go for login, you can enter the enrollment number and date of birth. There you have an option for download e-UDID certificate as well as the card. So
is it valid like original?
Yes, sir. Yes, sir, it will be valid. It contains a barcode, so that if you scan the barcode, it will show the details of name, disability percentage, and some things. So it will be valid, sir.
Thank you. Thank you. Karthik, go to next. Harish.
There is one question from the chat. I think if Muniraju sir can address that, that would be useful. So one of the question that is that they do have multiple disability. Now, when they apply online through UDID, the same acknowledgement which shows that there are 11 or 12 hospitals in Bangalore, and they do not know to which hospital they should go. For example, the person has intellectual disability and blindness, but they come to NIMHANS, only intellectual disability would be assessed, but again, they would be sent back to blindness assessment to Minto Hospital. So ideal thing and that they would benefit is that if on the acknowledgement slip itself, where multiple disability would be assessed, instead of going 1 to 2 or 2 to 3 hospitals, they would go directly to the hospital where multiple disability assessment would be carried out. So on the acknowledgement, which board actually is attached to that hospital, if that is there, that would ease a lot of these, it makes more user friendly to them. So, sir, do you have any suggestions, thoughts, ideas on this?
So now Government of India letter software.
Sir, Muniraju sir, I was suggesting one thing.
Yes.
We had requested long back Government of India
that
the moment somebody applies, they should be at least mapped to the hospitals. That is first thing. Second thing is, we from our side have to, see that which authority is there, which side. Like Harish told, that orthopedic disability is not assessed in NIMHANS. So we cannot map NIMHANS for orthopedic disability. We can map NIMHANS only for intellectual disability, SLD, autism, neurological problems.
So we can segregate the hospitals, no?
Yeah. So, but that background mapping in the software, the moment the person applies, that should happen from MOSJV, Minister of Social Justice Empowerment. We repeatedly asked Mr. Yar Heliyuru, MOSJV nalli.
Tarika.
Not Tarika, Director Rao sir. So we requested Rao sir also. Yeah. So, but nothing has happened. My request is, sir, Tamma Mulka once
we will do one thing. So we will do one thing. So once again, we will write a letter to the concerned authority.
Sir.
Isn't it? So then only we can clarify for all these things.
Madam, KVS Rao ನೀವು ಹೇಳ್ತಾ ಇರೋದು.
ಹೌದು, KVS Rao ಗೆ ಹೇಳಿದ್ವಿ. ಮತ್ತೆ Gaurav Gupta also we had told UDID who was there, but nothing has happened. There is no facility to map, person with disability when he applies.
ಇವರು ಡಾಕ್ಟರ್ ರಜನಿ ಅವರ ನಿಮ್ಮಂತ ಲೆಟರ್ ಹೋಗಿದೆ ಅಂತಲ್ಲ ಹೆಲ್ತ್ ಇಂದ.
ಹೆಲ್ತ್ ಇಂದ ಹೋಗಿದೆ ಸರ್, ಬಟ್ ನೋ ರೆಸ್ಪಾನ್ಸ್, ನಥಿಂಗ್. ನಿಮ್ಮಿಂದ ಒಂದ್ಸರಿ ಕೇಳಿ ಸರ್.
ಸೊ ನೀವು ಒಂದ್ಸರಿ ಇನ್ನೊಂದು ರಿಮೈಂಡರ್ ಒಂದು ಹಾಕಿ ಅವ್ರಿಗೆ.
Sir, 2-3 reminders we have put, sir. I can share that letter to you. Repeatedly in the WhatsApp groups also I have requested, but nothing has happened. I can share those letters to you, sir.
Okay, ನನಗೆ ಅದು ಕಳಿಸ್ಕೊಡಿ, ಶೇರ್ ಮಾಡಿ. Tomorrow I will discuss with you. Okay? Right.
Puneet, I think there is a question that if the online tracking shows dispatched and it has not arrived for a while, what is the next step that can be taken for getting the hard copy?
Sir, for that, they can send the details to a district disabled officer where they have format for those who have not received the original card. So we will send again to Delhi team to print it again, sir. So they will again receive the card by post.
And
So how many days
they will have the software, the soft copy which they can. May I make a request? Sorry to interrupt. There are people who are attempting to ask questions. I would request that we have a number of questions. If you do want to ask a question, please put it in the chat, because there are a number of questions we still have to address. I request all of you, please put it in the chat if there's a question you want to ask.
So can I take the next question?
Yes, Karthik, please go on.
So one of the questions, probably a more general one, and so the question is, if UDID is a national card valid everywhere in India, why we cannot accept Aadhaar card in which the address is from another state?
Sir, Aadhaar card is accepted as identity proof. For address proof, they should provide anything in the local residential proof they can provide, sir. So Aadhaar card is accepted in the portal as identity proof. So for address,
I think Karthik, can you just repeat it? We'll again put it in a different way. If Aadhaar card is accepted, why not UDID? Karthik, can you repeat it?
Yeah, I'll repeat the question. The question is, if UDID is a national
Can I
card.
paraphrase, Harish? Can I paraphrase? Because you are.
Yes, sir. Yes.
Yeah. Aadhaar cards from other states not being accepted in. Aadhaar card from Tamil Nadu not being accepted in for assessment.
So not hearing properly. Hello,
Deepak, can you repeat? Your voice is not clear.
I got the question. What he's asking is, if the Aadhaar card is issued from Tamil Nadu, why can't they
the
get
question
apply
was,
in Karnataka?
can you hear me?
The question, I guess.
That seems to be what the caregivers are.
Deepak, you are not audible.
Yeah, I think the network issues, that seems to be the question, that Aadhaar card from another state may not be accepted in a hospital from another state. So Aadhaar card from Tamil Nadu may not be accepted in Karnataka, or it's not easy to issue the card. I think this is a question about the software platform and how people are assigned to various hospitals.
So since the applications are divided based on the district, so if they applied in Mysore district with Mysore address, the application will be diverted to Mysore concerned hospitals. If they apply through Tamil Nadu address, the application will be diverted to Tamil Nadu side. So we ask them to correspondence address to be local one. So Aadhaar can be accepted as identity proof, but for address proof, correspondence address, we need a residential proof with local entity, sir.
Okay.
Rajni madam, one of the question asked by one of the participant is that when they approach a hospital for a medical assessment, sometimes children who may have a range of problems, they would be asked for repeat evaluations. So I do agree that, because I'm also a clinician, medical board discretion, sometimes medical board would require 2 to 3 times or even 4 times.
Yeah.
So, but to minimize the inconvenience to the families or people who already are burdened by people who have special needs, is there any directions to the medical professionals to fasten it or to make it more user friendly by reducing any kind of possible multiple visits?
See, that is the usual direction what we give in all our meetings, that they should not be made to run around unnecessarily. And as clinicians, we understand, all of us, you know, you and me are also clinicians. And if in need, we have to call the child or adult again for various reasons. So yeah, that general instruction to the doctors anyway will be going through the meetings that they have to do it at the earliest. They shouldn't be made unnecessarily to run around. Okay. So otherwise, there is no specific guidelines sent to the clinicians that how many times they should call or whatever.
Karthik, anything else that you can take it up further?
No, sir. For now, we've covered most of the questions on the chat.
Harish,
Yes, Deepak.
I think we should summarize two things. One is about how cards are allocated to various hospitals once more, because I think a lot of the doubts are about it. Second is about what do you call, people are asking questions about assessments of IDD such as Down syndrome cannot be on a percentage basis. So maybe one or two of those we could take.
Karthik, can you read out that question related to that Down syndrome?
It is more of a comment rather than a question, but it says assessment of IDD such as Down syndrome cannot be on percentage basis.
So to just add on some information is that all medical boards will do assessment of disability only according to the guidelines issued by the Ministry of India in 2018 for assessment of specified disabilities, be it as locomotor disability, be it as intellectual disability or mental illness. So every medical board has to follow the guidelines issued, whether it is Down syndrome or anything. There is no scope for any additional own decision by the medical board. Medical board will follow the guidelines. I hope this would address the question that is related to Down syndrome, because intellectual disability, according to these guidelines, it is categorically says that if a person has mild intellectual disability, it is 50% disability. If a person has moderate intellectual disability, it is 75% disability. If a person has severe intellectual disability, it is 90% disability. If a person has profound intellectual disability, it is 100% disability. So this is fixed in the guidelines. Nothing can be changed in that. Deepak, you asked one more. I forgot. What is that?
No, I think there were one or two questions about, again, I think Mr. Swithin has asked, do bipolar patients require IQ test? Can we avail it from NIMHANS? We are from Kerala. My son's been treated in NIMHANS. Is it possible to get a temporary certificate, as we have waited a long time, almost 2 years? I think one thing that we should, maybe I can clarify that. Yeah. I think I'd like to reiterate what Mr. Puneet had said, that currently the software system that has been created by the central government has a mechanism by which a person's application is sent to the hospitals which are closest to them, ideally in their own district. So that is why when somebody applies through the online portal, on the basis of where they come from, it is sent to a hospital based on that. So if somebody from Tamil Nadu were to come to NIMHANS, unfortunately their application would not come up even in the NIMHANS list of applications that are possible. So I think that is something that we have to acknowledge. I know that many people have questions about whether that should or should not be the case and whether that should be changed. I think we should acknowledge that the people here, Dr. Rajini, Mr. Puneet, Dr. Muniraju, don't have the power to change this. But I think parents and caregivers who feel that this is too much of a burden and it should be changed need to make an application. I think part of the idea of having this meeting today was to show that there is a need. And I think it's very important to have your voice heard and say that this is an important change that you want, because sometimes I think many of the people here have advocated for this change for a long time without success. Dr. Rajini, would you like to add anything?
I mean, I think they can also request Government of India through their letters. Is that possible? Like this is what is being the system right now, and it would be nice if the system is changed this way. Like a treating doctor, treating hospital, even if it is a different state, should be able to give. I'm sure we have discussed these things, Dr. Jagdish sir, myself, Deepak, Harish. many times that, you know, we want to help our clients, whether they are from Tamil Nadu, whether they are from West Bengal or Kerala or whatever. But unfortunately, that is, you know, difficult right now. What do you suggest, sir? Jagdisha, sir?
No,
How do you advise the people here, the needy?
Yeah, I think there should be some kind of a campaign to by many NGOs and also from the government also. From maybe we can re-represent once more from your department, from the Disability Welfare Department of Karnataka. We can request the central government to make options like this available.
Yeah.
It is going to be very, very useful for people who take treatment in different states.
Somebody has written, Niman's director, yeah, Srinivas Murthy sir has written, Niman's director should take it up.
Sir, Niman's director has taken it up many times. So, sir, we will
Once
request
more.
you to,
Once
if you have
more.
any contact, you also please help us, sir.
Once more.
Sir, Madam Rajini and Muniraju, sir, my request would be, if it can be.
Sir, your voice is not audible.
Jagdisha, sir, your voice is slightly feeble.
There's a, can you hear me now?
Yeah, yeah.
Slightly better. Slightly better, yeah.
Yeah. If there should be a place where people should know if they are not happy with whatever, who is the first appellate authority. If they are not happy with, for example, DDWO, if the DDWO doesn't do his or her work, who is the second appellate authority and who is the third appellate authority? If these things are made very clear, then it will be useful, because now what has been told is that if you have grievances, you approach, let's say, DHO or DDWO. What happens commonly is that they do approach, and for various reasons, DHO or DDWO may not take it seriously. There should be a second appellate authority and there should be a third appellate authority. If it can be made very clear and brought to the public's attention, then it will be very helpful for many persons with disability.
Okay.
I think we are reaching a conclusion of this program. So our intention of this program to sensitize the caregivers, and our intention is to coordinate the resource person, overall authorities, to help the system more user friendly, and the system should be more transparent and more vibrant and visible. So that is our intention, and ultimately to reach the needy people. So this any program we can make it in any states, and it's very difficult to implement for needy persons. So this is, it's not a one-day journey. So we keep on to work with the people and authorities, and as a mental health professional, we should aware about this. Then only we can able to understand the pulse of the people needs. So with that intention, we have started this program, and we are selecting different topics which is required. So I thanks all the participants and the resource person. On time they have login, and they actively participated. Madam actually, and for sir, Muniraju sir and Rajini madam, as well as Punit Kumar. So in their busy schedule and actively they have participated. We have circulated questions also. I think one day before we have circulated, they have also prepared for that. And they are assured in the sense, they are also going to put it in their work in a visible manner for needy people. That much I can tell. Arish, you can give your final remarks.
Yeah, I think I just would like to quickly summarize because some other people I think are not from Karnataka, it seems. They're asking questions related to Bombay and those appointments related. So a quick summarization that I would say is that in this we have primarily focused on Karnataka state UDID related issues. More so that is what we have circulated. But one thing that I can say is that in the UDID software, the existing mechanism is that anybody applies application will be redirected to nearest district hospital. So somebody has taken treatment even at NIMHANS. If the residential address is in Kolkata, if they apply online, the application will go to Kolkata. It will not come to NIMHANS. That is what the existing system is there. As Deepak had suggested, family caregivers and NGOs should proactively consider to put it across to Ministry of Social Justice to consider modifications in the software that people should be able to approach to the hospital where they are taking treatment for disability certification, not just the area which they do have a residential proof. They should have both options is what proactively can be considered because it from professional point of view, I think many of our colleagues from state government and central government different levels, they have already submitted this request for the government. NGOs and family caregivers can add on their voice to make this happen a little early. That is one. The second thing is, as Dr. Muniraju has said that he will soon share with us about the details about VRW, MRW and URWs, and they will display those details in their website. That will be a huge useful for many of the persons with disabilities to get any kind of coordination and help because they would facilitate needed any kind of medical appointments or if there is any troubleshooting, they would facilitate that kind of thing. Once this information is there with us also, we would like to share with everyone who has either joined this session or who has responded to our surveys or who has earlier participated in our R2R sessions. And as Madam Rajni Madam also had suggested that once application is made and the e-acknowledgement is generated, the family caregivers or the persons with disabilities are encouraged to approach nearest district hospital or the hospital on which it is written on the acknowledgement to fix an appointment for disability assessments, because some hospitals would do disability assessments only on a particular day because they do have different kinds of OPDs or whatever different mechanisms. They may have identified days for disability assessment. So if people without knowing that, if they would visit the hospitals, that would add on little more trouble to them and it necessitates multiple visits. So even before going to the hospital, if they can find out that information, that would ease a lot of their troubles that even from erupting. And with respect to modification of details, as Puneet had suggested that before UDID generation, people can log in from their side. They can modify the details of whatever that spellings or address. And if after UDID generation, it is the only hospital which has issued certificate will modify the details. So people has to apply to the hospital only once UDID is generated. Now, Umesh sir, I think wants to add something. Sir, please, you.
Thanks, Dr. Harish. ಕೇರ್ ಗಿವರ್ಸ್ ಬಗ್ಗೆ ತಾವು ಹೇಳ್ತಾ ಇದ್ರಿ, ಕೇರ್ ಗಿವರ್ಸ್ಗೆ ಏನಾದ್ರೂ ಅನುಕೂಲ ಮಾಡಕ್ ಸಾಧ್ಯತೆ ಇದೆಯಾ ಅಂತ ಹೇಳಿ. ನಮ್ದು 5% ರಿಸರ್ವೇಶನ್ ಅಲ್ಲಿ ಈಗ ಯಾವುದೇ ಅರ್ಬನ್ ಲೋಕಲ್ ಬಾಡೀಸ್ ಆಗ್ಲಿ ಅಥವಾ ರೂರಲ್ RDPR ಆಗ್ಲಿ 5% ರಿಸರ್ವೇಶನ್ ಅಲ್ಲಿ ಬಹಳಷ್ಟು ಆಕ್ಷನ್ ಪ್ಲಾನ್ ಅಲ್ಲಿ ಇದನ್ನ ಸೇರಿಸಿದ್ದಾರೆ. ನಮ್ಮ ರಾಜ್ಯದ ಬೇರೆ ಬೇರೆ ಭಾಗಗಳಲ್ಲಿ ಈ ಕೇರ್ ಗಿವರ್ಸ್ಗೋಸ್ಕರ ಅವರಿಗೆ ಮಂತ್ಲಿ ಇಷ್ಟು ಅಂತಾನೋ ಅಥವಾ ವರ್ಷಕ್ಕೋಸ್ಕರ ಅಂತಾನೋ ಇದನ್ನೆಲ್ಲ ಕೊಡ್ತಾ ಇದ್ದಾರೆ. ಅದೇ ರೀತಿ BBMP ಇದೆ. ಇದ್ರ ಬಗ್ಗೆ ಇನ್ನೂ ಸ್ವಲ್ಪ ಸೆನ್ಸಿಟೈಸ್ ಆದ್ರೆ ಕೇರ್ ಗಿವರ್ಸ್ಗೆ ಇನ್ನೂ ಸ್ವಲ್ಪ ಅನುಕೂಲ ಆಗ್ಬೋದು ಅಂತ ನನ್ನ ಅನಿಸಿಕೆ. ಕೇರ್ ಗಿವರ್ಸ್ಗೆ ಈಗಾಗಲೇ 5% ರಿಸರ್ವೇಶನ್ ಅಲ್ಲಿ ಅಲೋಕೇಶನ್ ಮಾಡಿದ್ದಾರೆ. ನಮ್ಮ ರಾಜ್ಯದ ಬಹಳಷ್ಟು ಕಡೆ ಇದನ್ನ ಕೇರ್ ಗಿವರ್ಸ್ಗೆ ಕೊಡ್ತಾ ಇದ್ದಾರೆ. ಈಗ BBMP ಅದೇ ತರನೇ ಒಂದು ಸಿಸ್ಟಮ್ ಎಲ್ಲ ಮಾಡಿದ್ದಾರೆ, ಆಕ್ಷನ್ ಪ್ಲಾನ್ ಎಲ್ಲ ಮಾಡಿ ಬಹಳಷ್ಟು ಫೆಸಿಲಿಟಿ ಇದೆ ಈಗ BBMP. ಇದ್ರ ಬಗ್ಗೆ ಸ್ವಲ್ಪ ಸೆನ್ಸಿಟೈಸ್ ಮಾಡಿದ್ರೆ ತುಂಬಾ ಜನಗಳಿಗೆ ಅನುಕೂಲ ಆಗುತ್ತೆ ಅನ್ನೋ ನನ್ನ ಅಭಿಪ್ರಾಯ.
Thank you, sir. So in the summarization process, one more thing is that as many has asked about support in terms of applying UDID when they do not have any gadgets or when they don't have any digital literacy, as Muniraju sir has suggested that they should consider walking into the, if possible, to the nearest district disability welfare officer who would facilitate this process. Otherwise, once this data of VRW, MRW, URW is shared, they can call them to get support. Who will facilitate this process? In UDID portal itself, there is a form which can be simply downloaded and can be filled with paper and pen, and it can be submitted at DDW office. So in the UDID portal itself, there is an option that they need not apply online. They can download the certificate, they can fill the certificate, they can paste the photograph, and they can submit at the DDW office, who will convert this into online application. So I think that would address some of the questions some people are saying about photo sizing, which they are not able to do, booklet conversion into less than 100 KB, which they are not able to do. So if they can able to do, that should be fine. But if they cannot, they can use this offline process of application and submit it to DW office. Deepak, and did I miss anything? I think I might
Yeah,
have
no,
something.
no, I think you've touched everything. I think for the people, there are people who have asked about specific support being stuck at various places. Perhaps you could email us at nimansrehab@gmail.com, and we'll try to help you individually, because we can't address that right now. But please email us at nimansrehab@gmail.com, and we'll answer your questions. I think Ms. Ruby Singh has asked many valid questions about physical disability and intellectual disability and multiple disability. Unfortunately, those are not those are larger questions rather than specific to the UDID alone and about the process alone. I think perhaps we can address that another time. But thank you to all the speakers, to the organizers, Dr. Charanam and Dr. Harish and Upasna and Dr. Karthik and Dr. Jagdisha for chairing. Thank you for everybody to participate. If you have any further questions, please email us at nimansrehab@gmail.com, because I'm sure that there will be more questions and we'll try to answer them. And we will see you next month again. We will announce the program shortly. Thank you. Dr. Jagdisha, any last words?
As usual, I will say that I request all the caregivers to spread the word about R2R to more caregivers. So more and more caregivers should join this forum and raise the issues. Thank you.
Thank you. All right, then, to everybody, thank you again. Good afternoon, and we'll see you next time.
Thank you.